You can see, the slides. So topic one is infrastructural requirement and one is legal requirement. In infrastructure part, first question, clinic with on. You first decide that if you want to start a clinic, you have to decide these four things. That in clinic with consultation facility or with dispensary or with short stay or with clinic with diagnostics. Mainly for pain, pain practice, we want clinic with short stay, because after doing intervention, you need to keep the patient for few hours, say 2 hours, 3 hours. It can be possible, maybe a bit more than that, but all are daycare procedures. Monoclinic or polyclinic. So whether only you will do the procedure or others also will come. So these questions are just I have written, which came to my mind while starting a clinic. There can be some additional question also, but if you plan to start a clinic, you should think about those things beforehand. Facilities, what facilities you will keep: fluoroscopy, USG machine, RF machine, ozone machine, PRP machine, those things. Emergency machines, of course, you should have. Emergency facilities should be there. Sterilization requirement is the major requirement for all procedure. Area should be sterile. And other things, name, type of business. Actually, this thing, what I am saying, more related to the Indian scenario. We need these things. Okay. So name, type of business, whether you want to start a proprietorship, company private limited, LLP, or partnership firm or charity. Nobody does. So most that is different. That doesn't come under so many laws also. That is different. So anyway, so mainly it is either proprietorship or company private limited. So let us talk about only proprietorship, nothing else. So first thing, another thing is, do you have a space? So clinic space minimum 75 square feet. So it can be different in some different country or different area, even in different states of India. Everything everywhere it is not same. But just think about it, that whether clinic space you have, waiting area, it should be there. So and then ancillary area. Ancillary area means when staff or doctor goes there and take rest, keeps book, those things. Short stay, minimum 65 square feet is needed. So only clinic a bit less, and another for short stay, this is the additional square feet area is needed. Toilet sometimes one, sometimes two. Optional, these areas are optional. Breastfeeding area. So for pain procedure, for pain clinic, we need some specific areas apart from clinic space and waiting area, ancillary area. So short stay area, we need procedure room, scrub room, changing room, observation room. So these areas you should have. And is the space safe for everyone? You have a big space, but that is a marketplace where every day truck unloading is done. So that is not safe. You will not get government permission. So legal requirement, you need a trade license. You are doing ultimately a business, so that is a trade license is required. So these are small documents which needed for trade license. Then GST, PAN number, current account, you may not take. In sometimes it is not must for a proprietorship. Pollution board clearance, that is must, because you will produce some injection syringe, those things. Okay. Legal requirement, fire license is must. Then comes clinic license. Clinic license, with all these things, whatever I have told, all this trade license, pollution clearance, fire license, then you apply for clinic license. So clinic license has multiple requirements. So after that, you take clinic license, and then comes PNDT license. Remember, PNDT is very important in India for USG machine. Okay. Otherwise, to prevent the female feticide, this PNDT license is required. So who can apply for PNDT license? So here there are different, these are the conditions in West Bengal, in my state, but in some other state it can be different. So you can understand these subjects. Radio diagnosis, obviously they will get, but pediatrics also they can take, and gynae they can take. Okay. And I don't know why pediatrics has been given, but not to anesthesia. So when there is one area through which you can get, that is 6 months course, but that is also, you have to check in your state it is there or not. Okay, then anyway, otherwise, what people does is through your friend, some friend of yours who is radiologist or pediatrics or gynae, they give their, they tell that okay, I will come to the clinic and I will do the, I will take the responsibility of this machine. Then you can get. Okay, application for waiving of form. There is one form F, that is actually for our pain specialists. We can use that because there is no question of any gynae ultrasound, no question of any chance of female feticide, that those things. So why to, we can actually, I mean, every month reporting we can avoid sometimes in some states, as I'm telling you. So licensing for CRM is also very essential for us. So there is also another licensing, AERB permission for CRM installation, Atomic Energy Regulatory Board. So that is also needed. Apply for TLD badge and after you get, and for installing a CM, there should be some, I mean, so that there should be some requirement, because this radiation should not go out. So this thing, and apart from this thing, of course, we shall follow the NMC guidelines, and we should follow the ISSP consent forms. Many in our society is also giving nowadays a lot of guidelines and all, so we should follow those things and signboards. So these things you will understand gradually. So these are practice protocol part. So not when you have started practice after establishing the clinic, so you will understand that. So anyway, this much only.